Hi friends, I am Dr. Pratap Snator. I have done MD in Forensic Medicine. In today's video, we'll continue with corrosives. In that, we'll discuss about caustic alkalis. Coming to chief poisons which are included in alkalis includes ammonia, potassium hydroxide, sodium hydroxide, calcium hydroxide, ammonium carbonate, potassium carbonate, sodium carbonate. Among them, many of them are used in households like sodium carbonate is used as baking soda. Sodium hydroxide is also used as a drain cleanser and others also used, some items also used for household items. Physical characteristics of most of the alkalis, they are extensively used in commerce. They occurs mainly as white powders. Among them, ammonia is a colorless gas which is very pungent and choking odor. Ammonium hydroxide is a liquid containing about 30% of ammonia. Coming to mechanism of action of alkalis, they are commonest cause of chemical burns. So they cause chemical burns. The hydroxyl ion produces saponification of fat when it becomes in contact with the fat in the body. Soluble alkaline proteinases, cellular dehydration can cause exothermic reaction. The ion passes from molecule to molecule, denaturing each in turn and burrows deeply, producing soft, gelatinous, friable HCAR, that is the liquefaction necrosis. So they pass from one cells to another cells, denaturing it, coagulating the proteins, causing soft gelatinous friable tissue, that is necrosis. It causes necrosis. Ingestion of any alkali produces severe effects mainly on lining of esophagus, while gastric environment is less common. Stricture formation is more common with alkalis than with the acids. Since it causes nuclear necrosis, it can lead to stricture formation. Liquid alkali preparations tend to cause more damage to stomach compared to mouth and skin. Coming to signs and symptoms, there is acidic caustic taste and sensation around the mouth and burning heat extending from throat to stomach when a person consumes alkali. Vomitus matters are alkaline and do not effervescence since they are alkaline in nature, do not effervesce on ground compared to corrosives, they effervescence. The vomitus mainly consist of dark alkali blood and shreds of mucosa. There is purging present accompanied by severe pain and straining. The motion consists of mainly of mucus and blood. Contact if the alkali falls on the skin, it causes grayish, soapy, necrotic area. Then on ingestion, there is abrasions, blister formations, and brownish discoloration on lips, skin, and above the mouth. There are discoloration occurs. The mucosa of digestive tract is swollen, soft, and a gray slough which can be readily detached. Then there is uterine stricture formation, which is a long-term complication of alkali consumption. Coming to properties of was common agents which are alkalis. Coming to household bleaches, which consist of sodium hypochlorite, can cause esophageal irritation but rarely cause strictures or serious injury. Detergents, which consist sodium triphosphate, produce serious tissue injuries. Drain cleaners, as I mentioned, sodium hydroxide causes extensive damage to esophagus and stomach if consumed. Ammonium hydroxide, which consists only 3%, can cause minor irritation, but higher concentration can cause severe injury to esophagus and stomach. Next, button batteries. Again, they are alkaline in nature. They consist of potassium hydroxide, which when swallowed can cause liquefaction necrosis following leakage from battery. Symptoms are most limited to GI tract. Then ammonia vapors, when inhaled, causes congestion, watering of eyes, violent sneezing, coughing, and choking. Sudden collapse and death may occur from suffocation due to inflammation. Much swelling of lower and later can lead to pneumonia. Fetal dose of potassium and sodium hydroxide is about 5 grams. Potassium carbonate is 18 grams. Sodium carbonate, which is commonly used as household items as baking soda, is 30 grams. Ammonia is 15 grams to 20 ml per grams. Fetal period is usually 24 hours. Coming to treatment of alkali poisoning, first is demulcents. So usually gastric lavage or stomach wash is avoided since it can cause more damage than treating. So demulcents are given to dilute or remove any to prevent further absorption, like giving white of egg or water to 1 to 2 glasses. In mild cases, if the concentration is less, alkali concentration less, stomach wash can be done, but usually it is not recommended. In poisoning by vapors, the person's oxygenation should be given to prevent remove any vapors. Tracheostomy may be necessary since esophageal and laryngeal damage may be present, so tracheostomy may become necessary. Then symptomatic treatment and required parenteral analgesics to prevent pain and antibiotics to prevent infection is symptomatic treatment is given. Coming to postmortem appearance, the marks over the mouth becomes dark in color and parchment-like after death. So when strong alkali is ingested, lips, mouth, and throat shows corrosions. Inflammatory edema with corrosion and sliminess of tissues of esophagus and stomach are prominent features. Mucosa may be brownish due to formation of alkyl hematine. Alkali may regurgitate and inhale, causing edema of the glottis, pseudomembranous inflammation of peripasus and leading to bronchial pneumonia. Perforation of esophagus and stomach is rare. It is commonly seen in cases of sulfuric acid poisoning, but it's very rare in alkali poisoning, but may occur in ammonia poisoning. Esophageal stricture formation, but though perforation is less, but stricture formation is common in alkali with alkalis than compared to acids. Testing of alkalis. The caustic alkalis produces brown precipitate when combined with nitrate. They also caustic carbonates produces whitish yellow precipitate when and effervescence if acid is added. Come to circumstances of poisoning, it is medical importance. Poisoning by alkalis is rare. Accidental cases occur due to its being mistaken for medicine. Homicide poisoning is again rare, but few suicide cases are seen. Sometimes solution of caustic soda is thrown with evil intention on the face and body by an enemy. Poisoning by ammonia is more common than any other alkalis. These are my references. Thank you.